you to go ahead and take out a piece of paper and write down 1 through 5. I'm going to take you through movements so that you can assess the true source of your pain. This training is specific for those of you that have low back pain. We are going to assess the true source of your low back pain. And you want to stick around all the way to the end because I'm going to assess something that very few therapists assess. Very few physical therapists, occupational therapists, or speech therapists are really going to look at this hidden source of persistent pain. So this is great for those of you that have that nagging back pain. Maybe you had an injury a long time ago and you think you should be healed by now, or you're just not quite sure of why you have the pain. Every day you notice that nagging pain with a specific activity or while you're sitting and sometimes while you're doing nothing. So we're going to really look at the true source of your pain. Many of you have probably sought the care of a healthcare professional, whether that's a physician or a physical therapist or occupational therapist. And maybe you had imaging studies. So that imaging, that x-ray or that MRI told the physician that yes, you have some arthritis in your joint, some joint changes. Maybe the MRI showed that you have some disc bulges. But really, when we're doing a full assessment, we need to correlate what we see happening with you and taking you through movements that reproduce the pain and correlate those findings on the physical examination with the imaging studies. They have to be crystal clear. And so today I'm really going to outline for you, make it simple, how you can identify the true source of your pain. So stay to the very end because this is an iterative process and we're kind of start on the surface and work our way down deeper to find that true source. Okay? So just to introduce myself, I'm Stephanie Carter Kelly. I'm a physical therapist and I use yoga in everything that I do. So I spent 30 years as a traditional physical therapist and then used yoga to find the true source of my pain, to really address what was going on deeper. So that's what we're going to get. We're going to dive deep. We're going to go deeper into really finding that true source. But when I found this, everything changed. All that I had done for my muscles and my joints and my discs, all that finally began to help when I identified something a little bit different. So let's start with muscle. How do we determine if muscle is the source of the pain? So we know that muscle gets lengthened. So when we lengthen or put muscle on a stretch, that can reproduce pain. When we contract the muscle, that can also produce pain. So let me show you the movements. I'm going to take my sweater off here so that you can see what's going on. And we can do that all from on the floor. I'm going to stay on the floor for this. So let's talk about lengthening first. So if you start on all fours, this is one way to lengthen out those low back tissues. I'll give you an optional way. I'll give you 2 ways to look at the lengthening. But if we come into what in yoga we know as child's pose, if you can sit your hips all the way back onto your heels and really get your forehead down on the floor, you are lengthening all of the structures of your low back. From the skin, that thick fascia. Notice I don't have fascia on my list, but sometimes that takes a little bit more to look at, fascia. But the muscles are being lengthened here. So does that reproduce the pain, the very specific same pain that you experience? Another way to do that very exact movement, if you have limitations in your knees and your hips, you might not be able to get into child's pose. Can you get on your back and bring knees to chest? Hugging those knees to chest. Let the knees separate apart from each other so that you can feel the low back flattening on the floor and the pelvis tips a little bit in order to lengthen the structures of the low back. Does that reproduce any pain. And it has to be the same pain. It can't just be a sensation of stretch. So maybe this feels good. That also gives you some indication about what might help you. So always keep that in the back of your mind. If it feels good, maybe you want to do that. So that's lengthening the muscle. So how do we contract the muscle? Go on your stomach. I'm flipping and flopping just a little bit, but go on your stomach. So from this position, forehead on the back of your hands, can you just lift head, arms, shoulders, maybe chest? Can you lift up off the ground? And how does that feel in your low back? So a lot of muscles are working here, but you're definitely working your low back muscles. So if you just lift everything up off the floor, does that reproduce the same pain? And that's the key. Does it reproduce the same pain that you feel on a day-to-day basis? So that's muscle. I brought a pen. Check. We've checked the muscle. Hopefully you wrote down muscle, joint, disc, nerve, and number 5, 1 through 5. So we've done the muscle. Let's talk about joints. So the joints of the low back, they come into contact. They sort of open and close. When you flex, they open, and those joint spaces separate away from each other. When you go into extension or backward bending, those joint structures come in contact with each other. So on the floor again, maybe that position that you just did where you contracted, maybe that hurt you. But can we do that passively? So put your hands by your shoulders, almost like you're going to do a push-up. Relax the entire spine. You're only going to use your arms here. Relax your legs. Press up into your hands. How does that feel in the low back? Does it reproduce the exact same pain? Go ahead and come down. And you can do that a few times just to kind of really tune into the sensations of your back. You're loading the joints, bringing the surfaces of the joints closer together. So does that reproduce your pain? Maybe you feel stiffness. Maybe you can't get into that position, but you don't feel pain. So again, that gives us some information. So when you are one-on-one with a therapist, they're going to ask a lot more clarifying questions to really understand the sensations that you're experiencing while you're going through these movements. But this is to give you some self-assessment. You can go through these movements to have some idea about what you're feeling. So that's the joint. One of the ways that I correlate some of the signs and symptoms with the joint is if you notice pain while you're standing and walking, that can be, so that's loading you while you're standing and walking, especially slow walking. A lot of times that is going to load you. When you walk, you go into that backward bending just a little bit. And so that gives you some idea about where the pain is coming from. Is it coming from muscle? Is it coming from joint? Now, disc. So our discs aren't typically the source of the pain, but it's the structures around the disc and where they're sort of exiting the spine. That is what we're really interested in when we're taking you through some of the assessments. So interestingly enough, the same exact assessment for the joint. So when you backward bend and you feel pain, it's the exact same assessment. But for the disc, when you do that activity with a few repetitions, you actually might feel better, right? So when you backward bend with the joint, it hurts. When you backward bend with the disc, up to 10 times, we typically do 10 times and say, well, how does that feel now? If that feels better, if the pain sort of moves up from the SI joint or from the buttock and into the low back and sort of localizes, or the pain dissipates completely, that gives us some idea that it might be a disc problem. Historically, in physical therapy, that's what we're thinking. So you would do the exact same thing that you did for the for the joint, completely relaxed, pushing with those arms. 1. Maybe you want to make sure you're breathing deeply and completely relaxed through the belly and through the low back as you do it. But see how that feels. If with every repetition it increases the pain, then I'm thinking, and we typically as physical therapists are thinking joint. And if it feels better, we're typically thinking disc. Okay? So, the next one is nerve. So, if you have some irritation on the nerve, and that irritation can be from the disc, but it can also be because of past injuries. Those past injuries where you had scar, where things heal down, there's scar. So if you tore a ligament, if you strained a muscle to the point where it did some damage and there's scar tissue now there. The thing to know about nerve is that it's a nerve itself does not have flexibility. It's the coverings of the nerve that have the extensibility. And the nerve actually slides through the coverings, almost like a nerve, almost like going through a tunnel. So you're taking a string kind of through a tunnel. We want that tunnel to be wide open and not shrunk down because of any scar tissue. So one of the things we look at with that is, so we'll come back onto the back, and in a good physical therapy evaluation, you stay in one position and they do all the tests in that position, and then they move to the next position, and then they do all the tests. But I'm kind of flipping and flopping so that we can go through each of the structures and so that you can really understand. So let's just play with the nerve. So the big nerve that we're talking about coming out of the low back, a lot of the nerves out of the low back form one bundle of nerves, and that's the sciatic nerve. The sciatic nerve runs out of the back, down through the butt, and along the back of the thigh, much like the hamstring does. So let's put a little bit of a stretch on the hamstring. So elbows are nice and straight. Just take one leg, hold the back of the thigh, and then extend the leg. And then bend it. And then extend it. So you're just going to go back and forth. Extend the leg, see how that feels, not in the hamstring. Remember, it's going to stretch the hamstring, but how does this feel in your low back? We're going to do that several times. There's a few different ways you can do this. We're just playing here a little bit, just to bring some awareness to those sensations. So if this position, if you feel this in the low back, that might be some indication that the coverings of that sciatic nerve are irritated. So we're going to add something. So just hold in this position, push that knee as straight as you can. Now you're going to pump your ankle. So if while you're pumping your ankle, you notice a change in your pain, or you notice that sensation in your low back, right? Because our ankle is not this, no muscle or joint tissue of the ankle is associated with the low back except for the nerve. So if while you're pumping that ankle, you feel a change in the sensation in your low back, it could get worse, or it could get better. Because sometimes as you sustain this little bit of stretch, you actually relieve that pressure and that tension. So the sensation that you feel could get worse or it could get better. Better then tells me as a physical therapist, I need to include that as a treatment. I'm always looking for what makes somebody feel better. So you should pay attention to that too. What makes you feel better? So let's just go ahead and try the other leg. So that was the left. Let's do the right. Grab the back of the right thigh. Straighten the knee and bend the knee. And see how that feels. Remember, not just in the back of the thigh. You may feel a lot of tension in the back of the thigh because your hamstrings are tight. How does this feel for your usual pain? Maybe that usual pain is somewhere around the SI joint. Maybe that usual pain is in the center of your low back. It doesn't really matter. We're looking to reproduce the exact same pain as you experience it every single time. Consistency is what we're looking for. Now just hold that knee as straight as you can get it. Your knee might not go as straight as mine, that's okay. Now you're going to pump the ankle. Point the toe, pull the foot back. Point the foot, pull it back. Again, how does that, you might want to even close your eyes just to really understand the sensations that you're feeling in that normal place, the typical place where you feel the pain. Center of the low back, maybe it's on one side. I've even had folks, we're moving the right leg. Maybe it's the left side of the low back that you feel pain. That's okay. A lot of things don't make an anatomical sense, but that's okay. That kind of leads us to number 5. So you can release that right leg. I'm going to talk about number 5 a little bit more. So number 5 is the one thing that very few therapists are going to ask you about. And if I go through the assessment, we did the nerve, let's check that off. If I go through this assessment 1 through 4 and things aren't lining up, like if I'm just not getting a really good anatomical or clinical picture of what's going on based on what the patient has told me about their symptoms during the day, and then all of the things I test, if I'm not getting a really clear picture, this is the question that I ask. What else is going on? What else is going on in your life that is specifically giving you stress? Because your stress can absolutely be the true source of your pain. Maybe it wasn't the first source. Maybe you had an injury 6 months ago, 6 years ago. And that should be healed. That injury should absolutely be healed. If there is scar tissue that's still because of that injury, we're going to find that in the physical exam. But if the pain is moving around and it's not consistent, then I am eventually going to say, what else is going on? Because this is not just, it doesn't mean that the pain is in your head. This is neurophysiology. If your nervous system is in fight or flight all of the time, a chronic low-level fight or flight, then the brain is going to send messages down into the body to tell you that, to alert you that something is wrong. But that something wrong is not necessarily your body. That something wrong could just be the response of the body to what else is going on in your life. So how do we know if stress is the true source of your pain? How do we know if it's the nervous system in the brain that is sending the messages down into the body as an alert, as an alarm signal to say, look and see what else is going on? We need to know because we may need to run away. We may need to fight. Or we may just need to be paralyzed in fear. So how do we know? I'm going to get a seat here so that I can lead you. The best way that I have found to determine if stress is the true cause is to look at your breathing. So we're going to look at the way that you breathe, both the pattern of your breath and also the length of your breath. So and what you can ask yourself is, yes, is this easy? Can I breathe fully into my belly and into my low ribs? And can I easily get this really long breath? So that, because the criteria for getting you out of fight or flight and into the parasympathetic nervous system, which is rest and digest, the criteria is that you can breathe 4 breaths per minute. Resonance frequency breathing is very slow and very relaxed. So I'm in sitting, and I'm going to lead you in sitting. If you prefer to lie down, you can do that. Lie on your back. We are going to feel some parts of the body just to cue into whether or not the belly and the ribs are moving correctly. Because if your breath is shortened and the pattern is confused, that will in turn signal the nervous system to stay in fight or flight. So if you had an incident during the day where you went and you kind of stayed in that upper chest breathing pattern throughout the rest of the day, then you can see why at the end of the day you're feeling more pain. We're not signaling to the nervous system to come back to relaxed and relieve that tension. So find a comfortable position and just bring your awareness to your breath, inhaling fully in through the nose all the way down to the belly. And let's just start by putting your belly on your hand on your belly, and breathe. So can you, in whatever position that you are, can you feel the belly expand with your breath? I like to then take your hands, the thumbs forward, the fingertips back, and lay those fingers on your back ribs above the small of your back. Your thumbs are on the deep side ribs. So when you breathe into the belly, can you also feel that expansion in the back ribs? In the very low side ribs. When you can feel the belly expand, you're telling that diaphragm to lower completely into the belly, completely fill the entire lungs and the rib cage. So that's the pattern of breath that you want. That's the mechanical pattern that you want. Belly, side ribs, feel that movement of the low ribs in the back and the sides. You have less movement of the shoulders and around the collarbones, less movement there as compared to the movement of the belly and the low ribs. That's the mechanical pattern that you want. Let's talk about the length. So I'm going to lead you into a long inhale, followed by an even and long exhale. So let's just start with a count of 4. Inhale. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4. And continue with that pattern. Inhale, 4 counts. Exhale, 4 counts. Inhale. Exhale. Now you want to make it longer. Inhale to 5. Exhale, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale. Exhale. Inhale. Exhale. Now, can you take it to 6? A count of 6. Inhale. Exhale, 2, 3, 4, 5, 6. Inhale. Exhale. Inhale. Exhale. Continue as I talk, making that breath long on the inhale and long on the exhale. So a breath cycle that is 12 seconds long is 5 breaths per minute. So stay here with this inhale to a count of 6, exhale to a count of 6. Your goal is to make that even longer. If you can get to an inhale, exhale breath cycle of 14 seconds, even to 18, or no, even to 16 seconds, then you are signaling to your nervous system into its default mode. The parasympathetic nervous system tells the gut to digest food. It tells the heart to beat at its normal rhythm. It signals to the liver and the kidneys and the bladder. It signals to all your internal organs that they can work at their optimum state. If it is difficult for you to get that nice long breath cycle of 14 or 16 seconds, then you are probably living in the sympathetic state of your nervous system. And that sympathetic state is telling the heart to increase its rate. It's telling the blood pressure to increase. It's telling digestion to stop and slow down. And it's signaling to the muscles to maintain tension. And it's that maintenance of tension in the muscles that many times gives you pain. So I encourage you to assess that nervous system, assess the stress that is signaling to the nervous system that is ultimately keeping you in pain. It may be the true source of your pain. So I hope that this helped you. I'm curious if any one of these was positive for you, or if you've gotten all the way to the end, can you see how that stress is keeping you in pain? Now, really assessing your pain well can be complicated. I have simplified it for you here today. So if you need help to really tease out what is the true source of your pain, then get help. You can ask me, you can contact virtual care to do an assessment, even on telehealth. As you go through these movements, a physical therapist or occupational therapist can ask those clarifying questions to really determine the true source of your pain. So I hope this helped. Let me know in the comments if this was beneficial to you so that I can know how to do more training